Good afternoon, North Dakota, and welcome to today's briefing. First up, today's COVID-19 cases. We had 10 additional cases reported today out of only 135 tests, as we predicted yesterday at this conference. We knew that Sunday was going to be a very slow day for gathering and collecting tests because of the Easter holiday. The one piece of data is 7 of today's 10 positive cases were people that were under the age of 50. If you take a look at the numbers on this, the couple things that jump out there that we want to point out. One is that we did, because of the low testing, 10 positives over 135 is a 7.4% positive. That's one of the highest we've had so far. But again, likely because of some of the sampling, the targeted sampling that we're doing, and also because of the low numbers. One number that's important to look at in the lower right-hand corner, the 3.1%, that is our rolling run rate since the beginning of this in terms of the number of tests positive. So that's the 341 positives over the 10,916 total cases. That remains the second best in the nation. If best is low positives, only Hawaii has got a lower percent positive than North Dakota. If we go to the next slide, again, the thing we want to focus on here is not cumulative cases, but number of active cases. And if you take the number of active cases we have is 194 cases, so closing in on that 200 mark. That is against 138 that have recovered, and again, only 13 that are hospitalized. One of the things that when we net to get that active, we're netting out recovereds minus the deaths. And because again, we had more people that recovered than the 10 positives. If you take a look at the very top of this chart, the numbers are getting a little bit small, but we had a slight dip from 196 to 194. This is only the second time that we've actually had a drop in the number of active cases in the state. We don't want to have a drop in active cases because people have passed away. That would not be a good thing. But we did have, again, more people that were reported as recovered than new testing. But again, as we've said multiple times, the data often gets a little skewed over the weekends because of less testing. It really got skewed this weekend because of the Easter holiday. When we take a look at the positive rate by county. Again, one thing that we take away from this is that we do have higher percent positives in the northwestern part of the state than we do in other parts of the state right now. We also, the patchwork of the white counties that are there, a number of counties still don't have a single positive in their counties. And we also have taking a close look. It's not shown on this map, but as part of our reporting and planning, we're taking a close look at all bordering counties that border on the Montana, South Dakota, and Minnesota side in case those people, as they often do, come to North Dakota for health care. And we should also note that they're the largest of the counties that border North Dakota with cases is Cass County, has 40 cases, positive cases. So we're paying attention to that. And we do have, and Fargo is Fargo, the metro area, continues to have a slight climb there at about 5% positive reporting. But together, I guess as we want to take a look at all of that, what I would consider all of that very, maybe inconclusive because of the low data on the weekend, it continues to be very positive. We're remain the ninth state in the nation, so in the top 10 as the amount of testing per capita, and number 2 in terms of positive test cases, and with only 13 hospitalized. What we've been saying all along, we're well positioned and well prepared, and we're going to talk a little bit more about that preparation today. But the reason why we're in good shape is not because COVID wasn't a threat. and we just have to ask the families of those that have lost a loved one to know whether it's a threat, or any of the people that have been hospitalized and lived through this thing to know this is a very serious illness. Or you could talk to any of the over 20,000 Americans, families who've lost a loved one. We know this was serious, but the reason why we're having good success in North Dakota is because we have so many people that are exercising the North Dakota SMART plan, and people have been reducing non-essential travel. They've been working to stay healthy with good hygiene. They've been keeping physical distance. We've, encouraged and see people now starting to wear masks, which can be a positive thing, and, not having group gatherings larger than 10, just a lot of great individual responsibility. And I just want to say thank you, because the numbers, when we see North Dakota as the number 2 out of 50 states, credit can go to every individual in the state for what they're doing and how people have changed what they've done, whether that's changing behaviors, changing travel, changing how you shop, changing to add many more hats that you're wearing, including perhaps helping your kids every day with their homework at home. But a lot of great activity going on, and again, it's just something that all North Dakotans can take a sense of accomplishment in because of the work that you've taken. The strategy, moving to the next topic, the strategy that we want to talk about and have talked about again is how do we save lives? This is always a strategy about saving lives, and we have avoided the cataclysmic outcomes that we've seen in other countries and in other locations around the world so far. And I say so far because we're still in this battle. The battle is not over yet. But the strategy to save lives, as we knew, was to make sure that people that needed health care could get it. If they needed it at the highest level, they could get it at the highest level, meaning could they be attended in a ICU situation with appropriate ventilators, with skilled staff. And so the whole point of flattening the curve on the bottom under the blue was to make sure that we did not overwhelm our healthcare capacity. And we've done a fantastic job at that. And we know that other places where they've had large counts, like in Italy with death rates, was when they overwhelmed their hospital capacity. But even with that, even though we've avoided having those two lines cross, the little line, the thin line that goes across with the arrow going up, we've also been hard at work the last 3 weeks working to make sure that we could increase our hospital capacity. We've had great support from all of the hospital providers across North Dakota, and we're so fortunate to have such a strong healthcare system in North Dakota. And leading that effort on the surge planning was our unified command, which is something we set up shortly after we entered this emergency. And they've been working closely with healthcare providers, and they've developed a surge plan. You're going to hear about that today. North Dakota healthcare providers do have the capability to provide, just at their basic, what they're doing today, more than 2,000 beds. That's why we've shown every day, and we showed on the slide earlier, that we are today using less than 1% of the hospital beds to do this. And so for the time being, while our absolute hospitalizations remain low, and we don't believe that any additional healthcare facilities beyond the hospital's own Tier 1 capacity is going to be needed, it is our responsibility in government to prepare for the worst case scenarios. And in that regard, our state is well prepared. So we've been preparing for the worst, but we're executing along with all of you for the best. And here to explain more about this surge plan is Tammy Miller, North Dakota's Chief Operating Officer. She's the Unified Command co-lead along with General Alan Dorman, and excited to also officially welcome her. She's been at the state of North Dakota only officially for 14 days. She was volunteering for months before that, but she started on April 1. Prior to that, she was the CEO of Border States Electric, which I'm sure many of you know operates in dozens of states and has thousands of employees. We're so excited to have her step in as North Dakota's second Chief Operating Officer, behind the great work of Jody Euchre, who continues to help us out during this incredible crisis that we're in. When Jody and I were recruiting Tammy last fall, and she agreed to start on April 1st, we didn't tell her we're going to be in the middle of a pandemic when she started, but she stepped up the plate and been contributing a ton right off the bat. So here's Tammy to tell you about the surge plan.
Thank you, Governor. It is just a great privilege to be part of Team North Dakota and to be a co-lead on the Unified Command working alongside General Dorman. You all know that a couple weeks ago the Governor mentioned that we were working on this surge plan, and we have been working diligently with a lot of other agencies, including Department of Health, the National Guard, DES. We've been working with a lot of hospitals, a lot of other community leaders, and we have a very good plan. Today I'd like to share some highlights of that plan, and then I want to share, though, to start, our overall mission. Our mission is to protect the citizens of North Dakota and to minimize loss of life and economic hardship. So as we put together this plan, the overarching goal is to ensure that our hospitals and communities will have the resources they need to handle any surge in COVID-19 patients. This plan will define the roles of all the parties that are in the plan, as well as all of the resources that are available. So for the purpose of our plan, we looked at 50 hospitals in the state of North Dakota, and we identified their bed capacity, and we have put their bed capacity and other resources into a number of tiers. So we start out with Tier 1, and that is really our current state. So the existing hospitals work within their current capacity for licensed beds, for staff, for equipment and supplies. When they reach capacity at Tier 1, then we move into what we call the contingency plan, and that has two tiers, Tier 2A and 2B. At 2A, the hospitals are operating within their increased bed capacity, and for the most part, they are using their existing staff with some equipment and supplies supplemented from the state of North Dakota. When they reach capacity at Tier 2A, then we move to Tier 2B. At this level, the hospitals need to increase their bed capacity. They are exceeding their staffing capacity, and they're tight on supplies and equipment. And the state will come in at that point and supplement equipment and supplies, like at level Tier 2A, but we will also start helping supplement staff. We have some resources for staff that I'd like to share with you. We have the volunteers in the Public Health Emergency Volunteer Reserve and the Medical Reserve Corps. We have a database of potential volunteers that include doctors, nurses, pharmacists, and EMTs. And today we have about 1,200 volunteers with the Public Health Emergency Volunteer Reserve and the Medical Reserve Corps. That Corps can also quickly call up other licensed professionals to increase the number of volunteers that we have available. So after 2A and B, if we exceed our resources, then we would move into Tier 3, which really is a crisis situation and a place that we don't expect to be. But at Tier 3, we have minimum care facilities. And at a minimum care facility, we would get that ramped up in 48 hours with the help of the National Guard. So to be clear, a minimum care facility is not an alternative hospital. It is a facility that is organized only to handle COVID-19 patients who may need hospital admission when it's not available. So as we carefully worked our plan, we surveyed the hospitals and we identified the bed capacity in each of these three tiers. So for Tier 1, that's kind of the current state, we have 1,860 staffed adult and pediatric beds. We have 238 staffed ICU beds for a total of 2,098 beds at Tier 1. Moving to Tier 2A, our bed capacity, which would be supported by some equipment and supplies from the state, we have 2,112 adult and pediatric beds, 282 staffed ICU beds. That gives us a total of 2,394 beds. Moving then to Tier 2B, At that level, the bed capacity would be increased at each of the hospitals, and we would have a surge of equipment and supplies and staff provided from the state. At Tier 2B, we would have 3,084 adult and ped beds and 400 ICU beds for a total of 3,488 beds. So without any additional capacity from the state, we have about 3,500 beds available with equipment, supplies, and staff supplemented from the state. If we need to get to Tier 3, the minimum care facilities, we could surge up another 4,000 beds that would be provided from the state, and those beds would be located in 8 regions, and we'll get into that in just a little bit. But let me be clear, we do not expect that we are going to need 7,500 beds for COVID patients. As the governor said earlier, today we have 13 COVID-positive patients from North Dakota in North Dakota hospitals, less than 1% of our capacity. But, as the governor said, we do want to be prepared. So the North Dakota Health Department will help us monitor the bed capacity. We do get information from the hospitals 2 times a week through survey, and that will move to daily starting on Thursday. So in the unlikely scenario that we would have to set up a minimal care facility, we would first establish these facilities in Fargo, North Dakota, and Bismarck, North Dakota. We have pre-positioned 200 beds at the Fargo Dome and at the University of Mary in Bismarck. So each Tier 3 facility would also have a medical team led by one of the local hospitals. And we know we have competing hospitals, great healthcare systems in Fargo and Bismarck. So in Fargo, we would have great coordination between Essentia and Sanford. Sanford would be the lead hospital. And in Bismarck, we would have great support and coordination with CHI, St. Alexis, and Sanford would be the lead hospital. So although we've identified a lead hospital, both Essentia and CHI, St. Alexis would be very, very important and very supportive to providing medical care as we move through a crisis in Tier 3. If necessary, we would then set up 6 additional sites in the state of North Dakota, and those would be Tier 3 facilities, minimal care facilities. The locations that have been identified are Devil's Lake at the Lake Region State College Gym, and our lead hospital would be CHI, St. Alexis, in Devil's Lake. In Dickinson, we would be at Dickinson State University, Weinbergen Gym, and our lead hospital would be CHI, St. Alexis Health in Dickinson. In Minot, we would be at Minot State University at the Dome. The lead hospital would be Trinity Health. Grand Forks, we would be at the University of North Dakota Wellness Center, and the lead hospital in Grand Forks would be All True Health. In Jamestown, we would be at the University of Jamestown Newman Center Larson Center, and the lead hospital would be Jamestown Regional Medical Center. And the 8th site would be in Williston State College, Thomas Witt Leach Complex, also known as the Well, and the lead hospital would be CHI, St. Alexis Health. So that's the plan for those minimal care facilities, and again, we don't expect to ever activate a minimal care facility, but we do have a plan for a worst case scenario. If we do set up a Tier 3 minimal care facility, the administrative management for that facility would be provided by our North Dakota National Guard. We had mentioned the role of the lead hospital. In a minimal care facility, most of the staffing would come from volunteers. We expect it would be friends and family members who would be provided personal protection equipment, training, food, and housing. So that is a high-level overview of our tiered plan for the surge if it does happen, the Tiers 1, 2A, 2B, and Tier 3. This plan was put together with a lot of cooperation from other agencies and communities. Each hospital has their own plan to support this. We also have a long-term care plan, and an emergency medical services plan that will complement this plan. As I said, we don't ever expect to use the Tier 3 level of this plan, but we are well prepared. And rest assured that we are doing everything we can in collaboration with the hospitals and the health systems in our state to work within that Tier 2B scenario. Thank you. I'm taking some of your notes. There we go. Thank you.
Thank you, Tammy. And thanks to everybody on the Unified Command. Thanks to everybody in the private sector, all of our Grace Hospital providers, everybody working together to put together that comprehensive plan. A lot of detail behind the summary that Tammy just shared, but again, know that we're very well prepared. Next up, new topic has to do with our tribal partnerships. And as you know, as we've been working across to slow the spread across COVID-19 across North Dakota. We've been working diligently from the beginning with the 5 great sovereign tribal nations with whom we share geography to make sure that we've got plans and capabilities to protect all North Dakotans. And we've had some great weekly calls from the start that have gone for hours. Some nights as we've listened to specific concerns and challenges within the tribal lands in North Dakota. And we've been working with, we're ready for if there was ever going to be a spike in any of these locations. As you know, that we did do some additional testing in Montreal County, both on Saturday and yesterday. We did that in partnership with MHA, Local Public Health, the North Dakota Department of Health, and the National Guard. And I do want to say again, we were able to collect 282 tests during that time frame. And some people might think this is really targeted, but when we go out and hold one of these drive-up testing, we get a lot of interest. People from addresses from 13 different counties came and got tested in Montreal, and 5 different states. And the 5 different states, I think, also can reflect the fact that up in Montreal, you're getting into the heart of the Bakken up there, and so that's why we may have had folks from different states. We've got 214 of those 282 tests back with the 10 positives so far. And so again, we do this because we want to stand shoulder to shoulder, ready to fight for the health of all North Dakotans, and we're super grateful for the great relationships we have with the tribal leaders and their councils, and the great communication that's going on. But the person that's at the point of all that communication between the governor's office and the state, of course, is Scott Davis, who's doing a fantastic job as executive director of the North Dakota Indian Affairs Commission. Scott's going to join us today to give an update on all the things we're doing with the 5 great tribes with whom we share geography. Scott, thanks for being here.
Thank you, Governor. Good day, North Dakota. Good day, tribal nations. Petuwashte, Bonjour, Ani. Before I want to get into the kind of the nuts and bolts of my comments today, I just wanted to start out with when this pandemic started out weeks or months ago. Time sure flies faster these days, but when a declaration of emergency comes to our state, and particularly to our tribal nations, there's a couple ways that a tribal nation can declare. And in this case, under this scenario, the tribes have all declared the state of emergency in partnership with the state of North Dakota. So by doing that, it released a number of resources and partnerships under the federal law with the Sanford Act. And so we've chosen to through common sense, work together to provide resources and share information, and that work continues today. And I'm so thankful. A lot of gratitude, as the governor uses that word daily. We use it daily. Our tribal leaders use it daily. The gratitude of the partnership that we have here daily and hourly, sometimes hourly, on some of the scenarios that we've been experiencing here in the last number of weeks here. So that communication is very powerful. As the governor alluded to, we have held and will continue to hold these weekly calls with the tribes, and they don't last your standard hour meeting. Some of these have lasted at least 2 to 3 hours, if not longer. And there's a wide array of questions and answers and resources and guidance information that we certainly share with our tribal leaders and vice versa. And so that is very, very important in how we continue the partnership we have with our tribal leaders throughout the state. Because I take note of this when I think about this virus, and I think most of you in North Dakota and our tribal nations would agree that this pandemic, this virus, does not see race, does not see ethnicity, does not see gender, does not see a border, does not see a tribal boundary or a state boundary. It's everywhere. So it just makes sense for us to continue to work with those tribal leaders in communicating. As you have seen and read, there are a number of governor's executive orders. Tribal leaders have done the same. Tribal chairs, tribal councils have made a number of tribal executive orders and resolutions pertaining to the same thing of social distancing, curfews, and so forth. And that information is found on our website. All the governor's executive orders, also the tribal executive orders, are all found on our website at IndianAffairs.com. So that's important that we share that information. Also, our office, through the good work of Mr. Dennis Newman, the PIO for office, has worked daily with our North Dakota JIC office in compiling the daily information, weekly information that goes out to each tribal leader every day. So again, that's a consistent, very consistent, fluid information of the data that we've collected, the testing, the results, information that it goes directly to our tribal leaders daily. So I'm very, very thankful to the JIC for doing that, and also with Dennis Newman in our office. So we also compiled a number of social media ads and messages throughout there. We did some radio spots, also some TV things that are coming to the tribal nations, and those are just strong messagings that are reiterated from tribal leadership and from our governor and our administration here. Probably the three big key leaders that we work in partnership with the tribes is obviously the Department of Health. Mylene and her team have been so outstanding in the communication that they've shared, and the physical work, as the governor alluded to, the testing we did this past weekend with MHA Nation has been very, very outstanding. I can't say enough with her leadership, her team, the Unified Command, General Dorman, his team, and in this case, Elbow Woods, all the ladies and doctors at Elbow Woods Clinic, Chairman Fox. Boy, what an undertaking. It took a lot of work to do that, and it was successful. And I know some of those results, Governor, as you understand, are still pending, but much more to work to do, obviously, in that end. So that work will continue. The other key leader on our team here with Team North Dakota is DPI, Kirsten Baser, Lucy Fredericks. I can't say enough how much communication we have channeled to our schools, our higher ed programs on guidance on school closings, meals for kids, and so forth. So that work will always continue. I know Kirsten will be on our call again tomorrow, as she always is, and so we'll be open to that. The other two that we're focusing on is as we see the Congress with Treasury and SBA coming down with a lot of economic business help is the North Dakota Indian Business Alliance that we have under our office and with Commerce. So Mr. L. Nygaard and Lyman Bursey will be leading that front on getting guidance and technical assistance to our native-owned businesses on and off the reservation. No different than across North Dakota. You know, we gotta stay open for business, and now that the resources are being channeled through the feds to our office, to our state, how do we navigate through those programs? So I'm very, very thankful for Al and Lyman for leading that charge for our office. And the other one is elections. As we all know, aside from businesses, elections got to continue. And again, we worked very closely with Secretary of State, Al, and Jim Silrum on how to continue these elections coming up in June. So we're very, very thankful in that partnership. And so we'll continue to work with the tribes and the counties on making sure those elections will move forward. But it's going to be a busy week, obviously, with the CARES Act from a tribal standpoint. I know we have a call here with Senator Hoven, his staff, and some people from Treasury. Again, very thankful for Governor and his support and letters of support, phone calls on some of that federal legislation that is so important to our tribal leaders on the business aspect, healthcare, education, and so we've been successful in some cases. Not everything's perfect when it comes through Congress, as we all know, but we are very thankful for the governor's support in making sure that we get those resources and financial needs to our tribal nations and businesses. So we'll continue to do that. So in closing, I think, again, I just want to reiterate how important this communication is with the resources that we have. Believe me, I'm on calls every day, hour after hour, and I listen to a lot of other states and a lot of other tribes in this country, and they're struggling. And it's unfortunate that we see and hear that. But these are the examples of the work that we've done in the last 3.5 years with the governor and lieutenant governor and the team, Team Burgum, and making sure that resources are available for our tribes. And this is an example of it. And so again, it's a lot of gratitude for that. But take note, this virus is real, and it's powerful, and it's something that we really need to respect. And I'll have to say it again, we really need to respect that. I mean, we have guidance out there. There are rules, whether they're state or tribal. And we as relatives, speaking from a relative standpoint, we need to follow those. We need to follow those back home. Tribal councils have made decisions, tribal leaders have made decisions, and these rules are just not for show or play. This is real. So we really need to respect what this means to our people. And because we all know, and in the country, we've been through a number of pandemics in the history of our people, and I'm very confident by following the rules and taking courage. Don't panic. Getting the facts. I know there's a lot of hearsay out there and gossip and so forth on Facebook, but get the facts. Those facts are laid out through my offices, through the governor's office, Department of Health, your tribal agencies. Continue to read what those facts are. And if you don't feel like you have the facts, call us. Call me. I've taken a number of calls from people, from constituents. If I can't answer, I'm going to call you back. But if you need the answers, the facts, I'll definitely get those to you in a timely manner. And lastly, I'll just say this: take courage. Take courage. Take courage in a good way. Keep your mind open. Pray daily. If you're like me and my household, we smudge ourselves daily. We smudge our homes, and we just continue to be thankful and have gratitude where we're at as North Dakotans and tribal leaders. So with that, I just say Wopla and Chi Miigwech. Thank you.
Thank you, Scott, for your leadership. Stick around, Tammy and Scott, for questions later. I would just add on the back of Scott's comments some gratitude. First of all, to the Codel. We've got a great Codel, and of course, a lot of things tribal relate to federal, whether it's Bureau of Indian Affairs, Indian Health Service, Indian Education. So many complex federal rules that touch and make the challenges there during a pandemic even harder. But I want to thank them, and I especially want to give a shout out to Senator Hoeven, who chairs the Senate Indian Affairs Committee. I spoke to Senator Hoeven last night. He's fighting hard, as you know, Scott, with Secretary Mnuchin to make sure that all the rules can be adjusted to make sure that the aid in the SBA packages can fully reach all of the entities on a tribe, including the tribal casinos, which are often the biggest employers in those communities. So thank you to them. And then also want to give a shout out to all the tribal leaders, but especially the chairs, in addition to Chairman Fox, who was mentioned here, that we collaborated with on the testing, but Chairman Faith, Chairman Azure, Chairwoman Kavanaugh, and Chairman White. Each of you have been fantastic, both in your frankness, your openness, your questions, and we appreciate and treat the relationship with real respect, and thank you. As I've told many people, I think there's a lot of hard jobs in elected jobs, whether it's a mayor, a county commission, a township, a school board member. Those are hard jobs. The hardest job in elected job in anywhere in our state is if you're elected as a tribal chair, because you got to deal with all those entities plus all those federal agencies. It is one hard job, so I have great respect for those that are stepping up and serving their people. And I know they have one thing in common, which is they all care deeply about their people. So thank you for that. Next topic is a behavioral health update. We've tried to include a little behavioral health update every day because we know that one of the side effects of the prolonged isolation that we've asked some people to participate in as they try to do the distancing of others. We know that that creates other challenges, but I want to start off with some thank yous because behavioral health is health. I think sometimes we think of health as something you go you go to a clinic or go see if you got a broken leg or you got some kind of physical illness, that's when you use the healthcare system, but mental and behavioral health is also health. We need to start thinking about it on equal footing as we do any other form of health, and the services and the supports that are provided by behavioral health professionals are more important than ever. So I want to kick this section off with a gratitude to all the behavioral health professionals in our state who continue to serve individuals and families, whether you're a counselor, a direct service worker, behavioral health nurse, peer support specialist, new program which we created that are working on helping people on their recovery, care coordinators, psychologists, and just family members that are there to be there when someone needs you. All of you are supporting the behavioral health of North Dakota, and so thank you for whatever role that you're playing. And today we want to go specifically to provide an update regarding the state's efforts to ensure a safety net for behavioral health services and to assure people that the behavioral health services are running uninterrupted for individuals being served at our state hospital in Jamestown. Well, the hospital the state hospital continues its COVID-19 preparedness efforts along with other hospitals, including current bed capacity is 100 with a surge capacity being prepared to go to 124. Additional 60 beds can be added on top of that. More than 400 employees that work there continue to provide the vital behavioral health services to those in need. But again, this is a very specialized organization. They provide specialized inpatient and residential care to individuals with severe, complex, or persistent mental illnesses or substance use disorders. So they've got a challenging job on any day of the week and a job they do with great hearts, but now they're having to do that like many other residential facilities, having to take the extra care under the threat of COVID-19 because it's a challenge for the patients and the staff. And I want to say thank you to all the members that work Team ND who continue to care for our citizens who are really challenged with behavioral and mental health as well as physical health issues. They're also on the front lines right now and taking all the precautions to keep themselves and their family members and our residents of those facilities safe. So great job. Way to go, team. Next topic, quick update. As of noon today, more than 17,000 participants are using the Care19 app. Again, you can download this at the Apple App Store, completely confidential. If you haven't done it, check it out. I've got mine downloaded on my phone, as does the First Lady. And again, appreciate anybody who's doing this. You actually are caring because you're helping to create, protect yourself and protect family members and help us get really excellent with contact tracing without giving up any information, personal information about yourself. So thank you for that. Check it out on the Apple App Store. Android, again, that's still coming, still on target for later this week. Next update is a commerce business update. The weekly Department of Commerce business brief that is hosted by the Greater North Dakota Chamber will be this Thursday, April 16th at 11 a.m. Central Time. I believe you can go online and register for that. It's free and you do not have to be a member of GNDC. We've had thousands of people tie into these calls each week, and there is great information coming from our federal partners, from North Dakota Job Service, from the Commerce Department, from the Bank of North Dakota. The briefings are concise and tight and super valuable, and would recommend that if you're in business in North Dakota, that you or someone on your team listen in to those business briefs. This one will provide guidance on the emerging information about financial support for North Dakota businesses. Also on the agenda, there have been increasing concerns, of course, when there's this much money flowing out of the federal government at rapid paces. We also know that there's a rapid increase in the potential scams. So they'll talk about concerns about fraudulent activity around the Paycheck Protection Plan and direct payments, what to watch for and how to avoid those scams. Additionally, on Thursday, there'll be new information around the employer payroll tax, employee retention tax credits that'll be discussed. And they're all been, again, and you can register, I guess, to go for this, again, by going to ndresponse.gov. There's a place to register there for this Thursday, April 16th, 11 a.m. briefing. And again, thanks to the great work of our CODEL, Congressman Armstrong, Senator Kramer, and Senator Hoeven, there's the $2.2 trillion CARES Act includes many supports through the SBA. You've probably heard about how the SBA is so popular that people are running through it. Again, running through it as in the dollars are quickly evaporating. There is an effort in front of Congress right now by unanimous consent to try to put more money into that. But for right now, would again encourage people to get their applications in. And again, as of April 10th, small businesses, sole proprietors, independent contractors, self-employed individuals were eligible to apply. So again, even if you don't think of yourself as a traditional small business or someone that may not have had interaction with these government programs before, check out because you may be eligible. And again, for more information, you can go to ndresponse.gov, select businesses and employers, or directly you can visit the website on sba.gov/paycheck protection plan. And again, encouraging people to act quickly because there have already been loans totaling $247 billion nationally. But in North Dakota, 8,000 loans totaling $1.4 billion have been completed by the SBA. So this is a real substantial financial relief. You may be eligible. Check it out, ndresponse.gov, business and employers. The daily update on unemployment, next topic, is the claims continue to climb. We're closing in on the 50,000 mark, so total regular claims, 49,716. The pandemic unemployment assistance claims since April 4th, that new program that came with the CARES Act, that's for the gig workers, the self-employed. There's 5,400 that have gone for that. And then the pandemic emergency unemployment compensation that also started on April 4th. There's 5,426. That's for people that were unemployed, but their unemployed benefits ran out and they can apply for additional 13 weeks. So again, check out that information at ndjobs.com for more information on those programs. Closing, before we go to the gratitude section, we always like to add a little good news. And here's a fun one, since today we were talking about tribal activities across the United States. Summer is traditionally a time for Native American tribes or universities like here at United Tribes Technical College to host powwows that showcase cultures and are fantastic gatherings. And this year, this spring, of course, many powwows have been postponed or canceled. But there's, of course, new things popping up all the time that have not stopped people from gathering, at least virtually. And the Social Distance Powwows, a public Facebook page where more than 150,000 members have joined Native American cultures by sharing songs, dances, and words of solidarity, words of hope, and words of prayer. Vendors who might otherwise be physically attending these this summer and make their living selling their beautiful beadwork, jewelry, and basketry or clothing, they're able to share their talents through a market page on this page. And this page even hosts weekly virtual powwows with a live lineup of volunteer drum groups, singers, and dancers. This week's Social Distance Powwow will take place Saturday, April 18th in two sessions, one from 12 to 1:30 Central Time and another 6 p.m. to 7:30 p.m. And it's just one example of creative and innovative ways that people are using and embracing technology to rise above the challenges today, to continue to come together to celebrate culture and tradition. The North Dakota Indian Affairs Commission, led by Scott Davis, is also inviting tribal members to share video messages of hope and prayer, which are either spoken, sung, danced, painted, or drawn, any forms that send a message of hope and comfort, and more information will be available from the North Dakota Indian Affairs Commission website. But thanks for everyone that's pitching in to slow the spread and finding new ways to connect while we're apart. We are all in this together. And in my closing gratitude comments today, we like to single out, there's so many people to share gratitude with, but today our shout out goes to all the public health hotline workers. There are so many of these on the national and the state level, and lots of different phone numbers which we've shared here. But just within the public health hotline within our own Department of Health, we've ramped that up. There's now 30 dedicated hotline workers who are over there rotating around to answer those calls. They've answered, hundreds and hundreds of emails and have taken over 8,000 phone calls to those hotlines, and they're working hard to make sure that citizens have factual and up-to-date and accurate information as we move through this crisis. And again, that hotline is available 7 days a week from 7 a.m. to 8 p.m., and that number again is 1-866-207-2880. 1-866-207-2880. When you call that hotline, take a minute and say thanks to the person that answers the phone. So with that, we say gratitude to everybody in the state that's helping us keep on this great track, and we'll move to questions. Jacob, first up today.
I have a question for Ms. Tammy Miller, actually.
Awesome, thank you.
Preparing these surge plans, and you're talking about having skilled staff and having properly staffed facilities, what role are the mass furloughs playing in your ability to make sure staff are ready to go at the different tiers?
Well, I think each hospital is working very hard to evaluate their staff. I know many of them are bringing on staff, getting them trained up, so I think that will in some ways help our resources, because as we went into the pandemic, our state had full employment. We had 30,000 open jobs. So I think those furloughs will give us a little bit of a cushion. And then we do have retirees that we're drawing on and others who might have been out of the workforce. But each state, each hospital in the state has their own plan, and then the state would supplement it through the volunteers that we have in our database as well. Yes.
I'd just like to follow up on that. Do you have a rough estimate about how many employees you'd need if you actually are at the tier 3?
Actually, I don't have that number, but I can assure you that each hospital is working that plan. We have been meeting with the lead hospitals one-on-one to make sure they have their plans in place, and then we will work with those next level hospitals later this week. And in addition to the hospitals, I know the long-term care facilities have good staffing plans as well. Yes?
I was wondering how many hospital beds are currently taken up by non-COVID patients?
We get those statistics every day, 2 times a week now, and it will start on Thursday daily, and approximately 50% of our beds are occupied. Each hospital, though, does have a plan to free up as many beds as possible. And they can do that through moving out swing bed patients, stopping elective surgeries, and some other avenues. Yes?
I've seen that photo of the Fargo Dome with beds in it circulating around. Are the other 7 locations also set up right now, or are they waiting?
No, and the intent was not to set up the Fargo Dome. The intent was to pre-position beds in Bismarck and Fargo in the event that we would have to activate. So we easily could have left those beds in a trailer in a parking lot. Yes?
Might I ask why the Fargo Dome was set up then?
We did have a kind of a protocol as sites were evaluated, and Cody is here, Cody Schulz from our deputy from Homeland Security, and he knows the protocol for evaluating those sites. And if I could, I'd ask Cody to come up and share a few comments about the site selection process.
Well, thank you. So to talk to the site selection process. So prior to them being set up, there was a thorough evaluation done in conjunction with the Army Corps of Engineers that came in to look at a number of different facilities to see which ones would potentially work best in this case. The short answer as to why they were set up is it was a bit of a proof of concept to make sure that we could get it done should they need to in exercise in a real world prior to a real world situation of need.
Tammy?
Yes.
Just curious, where is the Tier 3 medical equipment coming from? Is that from the state medical cache?
Yes, it is. It is. And we also have networks with other states to also get resources that might be coming available as other states are starting the recovery mode. Sure.
Quick hitters, I guess. Do you have any idea how many ICU beds are normally taken up, or I guess right now?
I don't have that at the top of my head, but that does come through to our in our surveys. So we will have that information now daily.
Ask about, you mentioned 1,200 volunteers. Were those all recruited in the last few weeks? And I guess what is the breakdown between retired nurses and doctors and that sort of thing?
And I don't have that right handy with me, but we can provide that. I don't know, Cody, if you have a good estimate on that. No. Okay.
Are they mostly like retired healthcare workers, though, for the most part?
Not necessarily. Just people who might not be in the workforce or who might be deployed in a different fashion right now who might become available.
Thing I wanted to ask, right now, I guess there's a disproportionate amount of cases in Cass County. Obviously, that's the biggest county in the state, but about 36% of the cases in the state are in Cass County. If the hospitalizations are unevenly distributed, what's the plan for that in terms of, a surge plan?
Yes. So first off, it might look like a disproportionate number, but you need to look at positives per capita. And if you look at those relationships, and I'm not sure if we had that on a chart today, but you would not see that the rate of positives in Cass County is the highest in the state. We have other counties in the state that have higher COVID positive cases as a percent of their population in the county. But to your point about if we had a lot of cases, the intent of the surge plan is to be able to transfer patients, and that's why EMS is so involved in the plan, because we would maybe put some nursing home patients that are in the hospital back in the nursing home. If they could. We could transfer patients to other hospitals that maybe don't provide the same level of care, maybe a step-down level, but all of that is built into the plan to maximize all of our hospitals collectively through that transfer system, and then only get to a Tier 3 if we have maxed out all of the capacity, first within the region and then looking across the state. Yes, Danny.
Hennon with Flag Family Media, KFYR Radio. How much is the cost for the use of the Fargo Dome or any other surge facilities to the state?
Cody, do you know that? No charge. Everyone is pitching in to help. All right, thank you.
Jack and then Lane.
Governor, you talked about the two types of pandemic unemployment claims that have come in. Have those $600, enhancements on unemployment, have those been started to be issued in the state?
I know that's the $600 relate to the one that I was describing as the pandemic unemployment insurance, which again, that's where we've received 5,410 of those. And I know that's what's been filed. I don't know exactly if those checks have gone out, but we'll get an answer to you. We'll go Lane and then online.
Governor, the $1,200 stimulus checks are starting to circulate, but for some people that's not going to be enough for them, and they may try to go back to work, which could put themselves or others at risk. Is the state planning on doing anything to help prevent that?
Help prevent what? Help?
People potentially going to work because they have to if the stimulus check is not enough for them.
Well, I think the one piece that we're looking at, because I think many people will get the stimulus check, the $1,200 per person. If it's a family of 4, then it's $1,200 plus $1,200 and $500 for each kid. So you're talking $3,400. So you've got that coming in for a family, or the $1,200 for an individual. That individual, separate from that, could also be apply for and receive the unemployment insurance that we've talked about. If they're a small business owner, in addition to the check, because there's really no qualification to get the check other than you've been an adult who is paid taxes or is also now registered to get the check if you weren't paying taxes before, because that really goes to everybody. If you're a small business owner, then you can qualify for a number of the small business programs separate from the unemployment, which then some of those are loans actually, but they're disguised as a grant, or it's a grant disguised as a loan because you don't have to pay them back. So I guess I'd call that a grant. So I think, again, this is complex because it's all new and it's all only a few weeks new old, but I would say that if people are feeling like, how do they make ends meet, they should be, again, calling, go to ndresponse.gov, go to businesses and employers, even if you're self-employed or if you're an employee, and check out those resources, try to see, because there could be 2 or 3 different programs simultaneously that don't overlap and don't conflict with each other, that don't eliminate your eligibility, that you could be getting all those resources. From the state standpoint, things we've looked at through our economic resilience task force, which has been going on for the last couple of weeks, is we're trying to see, is there a place where we might fill in the gaps that the federal government hasn't. That's the work that we're doing with the Bank of North Dakota, and the Commerce Department is trying to figure it out. Right now, these federal programs are quite comprehensive, and one area we have been talking to the CODEL about is to make sure that the dollars that were allocated to the state, you heard earlier there was a $1.25 billion that were going to go to the states. That interpretation, that language is not out yet. How that actually gets interpreted, if we could use that, say, for example, to help reinforce the unemployment insurance fund at the state, that would be a great thing for all states to be able to do that, to make sure the money is there. But we'll keep looking to see where those gaps are for individuals. Online?
Alan Burke with the Emmons County Record. Is there any word on when rapid testing will be available in rural hospitals?
For Alan, no word. I mean, in the sense that, there's lots of discussions about that there's more testing and faster testing coming, but those are weeks away, not days away. Don't have any definitive date on when that would get here. And by mass testing, we're talking about the serological, meaning like the finger prick blood tests that you can get a result instantly, and they're super low cost, and you could do them for everybody heading into a factory or everybody heading into a workplace. And that's the kind of the mass testing where people may be getting tested multiple times over a period of time if there was an outbreak. That testing not available yet, but know that is, manufacturers are hard at work trying to deliver that, because for us to get back to even the new normal, we're going to have that broader testing. Dave, and then Jacob.
Yes, Governor, over the weekend, a long-term care facility in Fargo reported a COVID case. I was just kind of curious. You issued some guidance on the 13th of March, I believe, about long-term care facilities. Has there been anything since that based on the Fargo report? Anything?
Well, this is a situation that we're working very closely with, because there's actually been 3 facilities in Fargo that have had cases. And when that happens, we want to come in and do what we've done, which is have the testing capacity to come in. In case 1, we tested all 120 residents and 60 staff. And we did that very quickly. And as once we had the first one come in, we were able to initially, that was contained to the resident. It was assisted living facility, was a resident, his spouse, and the receptionist. When we tested the other 120 and the other 60 staff, we only came up with 3 more positives. But people remained in isolation prior to when we got the testing done. They closed all their congregate eating and all the other, their workout facilities, all that stuff. That's the kind of response, that's the kind of the good result you want to have where when you get that, and we've been trying to practice that model in the other 2 facilities. And of course, it really varies by facility. Some facilities that might be multiple floors with multiple pods with multiple wings have the ability to create isolation if they have one. Sometimes they get someone who's a COVID positive, they're out and they go to the hospital, and then they come in and do all the disinfecting. And there's been a lot of diligence by long-term care to make sure that there aren't people that would travel across. So nursing teams have been segregated into different teams. And I think something that we have to pay close attention to is if you're a physical therapist, if you're a chaplain, those kinds of things. So there might have been one for the whole facility that would have contact with a lot of patients. We're trying to really work with the providers to make sure that you don't have what could end up constituting a super spreader in one of these cases. And we're very fortunate so far that again, because this is an area where there's people are talking about opening back up, but for me to be convinced that we ought to be sort of quote back to normal, we've got to make sure that we have a proven capability to protect particularly our most vulnerable citizens that are living in these congregate living situations, because it can, as we've seen in dozens and dozens of other states, below the headlines, read below the headlines. It all started with that one case in Kirkland, Washington, where 35 deaths out of 125 people. That has repeated itself in other states where there have been mass outbreaks, multiple deaths in facilities. And so this is one of the areas where this is a virus is particularly deadly, and we've got a real commitment to those individuals. As I've said before, in North Dakota, we have a higher percentage of people over age 65 living in our 218 long-term care facilities than any other state, because that's good news because people live a long time in North Dakota, but we've also got a lot of long-term care facilities. Jacob?
Governor, with other states talking about opening back up, does that change North Dakota's ability to compete with other states to acquire medical supplies?
I don't know that we were, I think you've noticed that we were never caught up in the whole hype about competing for medical supplies. We had great providers here that had systems that were doing their own sourcing. We had a strong medical cache. We also were calm enough to understand that we had to keep looking at the numbers in terms of the actual patients that were coming in, and it's as the thing, there's been a whole there was a shortage or a perceived shortage of equipment, then there's been a massive increase in supply, and now you may see a decrease in demand. So I think when the further out you look, the likelihood that there's going to be a shortage of equipment is pretty slim. I mean, I think we got, you've heard states that had gotten 400 ventilators out of the national medical cache that didn't need them, that sent them back. I mean, there's I think going to be a lot of availability of equipment. So the things that were in short supply in the early days of the huge outbreak, particularly in the New York metro area, I don't think we're going to see that across the rest of the country. I think we're going to be in good position in terms of beds and equipment. Jack?
Just a point of clarification, Governor, did you say it was next week or later this week that the Android version of the Care 19 app will be unveiled?
Last week I said next week, so this week it would be later this week. One more online.
Renee Jean with the Williston Herald. Have we asked for any N95 masks from FEMA? And if we have, how many did we ask for, and how many have we received?
Cody, you want to shout out an answer to me, or?
I don't have the answer. We have asked, and we received a portion of what we asked for to date. I can get those numbers by today.
So I don't know if you've ever heard that, but we can get that. We can get that data. But we did start out, I think, with a large quantity of masks. I know early on we shipped 50,000 masks to Montana when they were having trouble getting them elsewhere, and we've got an order in with the feds and are replenishing, but I think we're in good shape on masks. But we can get the exact info. Other questions? One more online.
Okay. Matt Henson with WDAY. On March 27th, personal care businesses such as hair salons, tattoo parlors, etc. were closed. They've been unable to get unemployment, and when they applied for a small business loan under the CARE Act, they were notified they were only eligible for up to $1,000. Is there a plan to compensate these workers if closures are extended?
I understand the question, but but in the context of the question, there was some information that's confusing me because that's not my understanding that they would be limited. I've never heard anything about that limit, and they should be eligible for the pandemic unemployment assistance claim. So I would just, maybe we can follow up with Matt and we can get the actual name of the individual that he's spoken to and contact them and see if we can help them. And if somehow they're not able to, we'll all have learned something. But I believe that there is programs available for, certainly those programs were designed for exactly that case of the, self-employed individual, gig workers, salon workers, all those folks. So if it's not reaching them, let's drill in and find out more.
Schulz said they are working to get the $600 checks out this week.
Okay. That was a question, I'm not sure who asked that earlier, maybe it was Jack, but the answer is that the $600 checks, which are part of the pandemic unemployment assistance, that's the $600 on top of your regular, or if you weren't part of the unemployment insurance, it's just $600 payment that they're working to get those out this week. Okay, other questions? Seeing none. I want to again, close by just saying to all North Dakotans, thanks for tuning in. Thanks for everything you're doing to help keep North Dakota safe and healthy and to protect the most vulnerable. Thanks for your input. Thanks to the media for their questions and everything they're doing to show up. Thanks for everybody that's listening in from the media around the state. We appreciate the online questions as well. And as I look through the back of this room out at the sunshine and a little breeze blowing, I think that the snow is starting to melt here again. So maybe springtime is here again in North Dakota, or at least coming in the few days ahead. But with that, as always in North Dakota, it gives us certainly the hope of better days ahead. And I know that North Dakota is going to come through this because, as we always have, we've always persevered, we've always innovated, and we know that'll be the case this time around. So thank you, North Dakota, and we'll see you tomorrow at 3:30.